Good afternoon. My name is Dr. Angela Leung. I am an endocrinologist with special expertise in thyroid disease, and I'm at the University of California, Los Angeles, and the Veteran Affairs Greater Los Angeles Healthcare System, both in Los Angeles, California. Today, we are speaking about thyroid disease, hypothyroidism in pregnancy, and with a focus on the patient.
How important is personalized support for those who are struggling to conceive?
This is an important question. Of course, we want to personalize medicine as best as we can to the patient who is sitting in front of us. And since we are talking specifically on the topic of hypothyroidism in pregnancy, the questions are centered around seeking if there's a family history of a similar situation, perhaps in the person's mother or grandmother. We know that thyroid disease runs a little bit more commonly in women of the family, so I would want to know that information. But also, I would want to know her journey of her trying to become pregnant. What is her history of perhaps a successful pregnancy that she has delivered? In order to target some of my questions and the types of thyroid blood tests that we would want to get.
Which criteria would prompt you to screen a pregnant patient for hypothyroidism?
This is an important consideration as well. We know that if we screen everybody with thyroid blood tests, to assess for potential hypothyroidism, an underactive thyroid gland in pregnancy, we may not get a lot of people who are screened to be hypothyroid. So targeted screening is essential in order to be most beneficial to the patient and to be cost effective, of course, to the healthcare system. So the criteria would be mostly centered around the person's history of hypothyroidism. Is there a known thyroid disorder in her or her family? Perhaps a previous pregnancy, she has had hypothyroidism in the past. This would be a very clear indication to screen for hypothyroidism with a serum TSH. If there's a history of infertility or perhaps miscarriages or recurrent miscarriages, this would also be another criteria to go ahead and get that TSH. Other things would be a known history of perhaps postpartum thyroiditis, things that would perhaps lead you toward thinking whether or not that thyroid dysfunction would be potentially recurring in the future with this pregnancy. A history of known antibody positivity to thyroid. So thyroid peroxidase antibody being positive, thyroid globulin antibody being positive, and then use of certain medications that are known to cause thyroid dysfunction, whether or not she has been taking any of those in the recent past. So those would be the sort of things that I would be thinking about in considering whether or not we would want to get a serum TSH to screen for thyroid dysfunction in this pregnant person.
For those diagnosed with hypothyroidism during pregnancy, what should their postpartum follow-up care ideally consist of?
So this is an important question, and the distinction is whether or not the hypothyroidism was known and pre-existing in the woman before pregnancy. They were already taking thyroid hormone replacement, for example, levothyroxine. And we know that during pregnancy, there's a greater need for more thyroid hormone. Thyroid hormone doses need to be increased during the course of gestation. But for her, the one who was diagnosed prior to pregnancy, the goal would be to revert her back to her pre-pregnancy dose. For the person who is diagnosed with hypothyroidism during pregnancy, sometimes we do start a little bit of thyroid hormone, perhaps in situation where the TSH is a little bit elevated, or even frankly, she has overt hypothyroidism where she clearly needs thyroid hormone support during the course of gestation. For this latter group, if the hypothyroidism is subclinical and very mild, chances are that she will likely not need continuing thyroid hormone after delivery. So the thought is to repeat the tests within the first 3 months or so after delivery and an attempt to titrate down towards zero the levothyroxine dose. For overt hypothyroidism, that would probably require a little bit more testing, but the thought is to continually to assess with TSH levels within that first year of postpartum care in order to see if we can go have her no longer continue the levothyroxine. So at this point, I'm so glad to be joined by our patient, Ms. Massa, who is here with us. She has this exact scenario, and I'd like to really highlight and give her space to this morning in order to provide her experience of how it is to be a person with hypothyroidism around the concepts of trying for pregnancy and recently pregnant. So our first question for Masa to this morning is, being a hypothyroid patient, what were your main concerns for when you were thinking about having a child? Did you sort of receive clear instructions regarding the levothyroxine dose that you were taking in case you got pregnant?
Sure. So you know that my situation is a little unique because I didn't have any thyroid issue before and during my first pregnancy. Everything was very straightforward back then. And after that pregnancy, I was diagnosed with papillary thyroid cancer and had a thyroidectomy. So my thyroid gland was completely removed. Since then, I've relied entirely on levothyroxine, of course, to replace my thyroid hormone. I mean, after the surgery, I came under your care, and outside of pregnancy, things have actually been very manageable. So my hormone levels have been pretty stable, and day-to-day life without a thyroid gland really hasn't been a big issue. Pregnancy, though, is a completely different situation. So thyroid hormone is extremely important for a baby, as you know, and my main concern was that whether my hormone levels would stay in the right range during pregnancy and how quickly they might change. I was also thinking about how often the medication might need to be adjusted to keep everything stable for the baby. So fortunately, I mean, I was under your care right after the surgery, and I remember that in one of the very early visits, you actually brought this up and told me that if I ever plan to get pregnant again, I should let you know right away because pregnancy requires much closer monitoring for thyroid hormones. And I mean, you clearly set the stage for me and helped me understand what to expect even before pregnancy was even on my mind. So regarding the levothyroxine dose, yes, I did receive clear guidelines about the levothyroxine dose. You actually increased my dose slightly before pregnancy so that my thyroid hormone levels would start a little on the higher side. Once I became pregnant, the plan was to monitor my thyroid levels closely with regular blood tests and adjust the dose whenever necessary. Before pregnancy, my levels were very stable for long periods of time. I had to just do once or twice per year blood tests, and the doses I mean, we didn't change the doses at all. But during pregnancy, it's very different. So even between lab tests that are only about 4 weeks apart, I can see noticeable fluctuations in the hormone levels. So when I see those changes in the lab results, I mean, it can make me worried, especially thinking about the baby's health and whether everything is stable in the right range. What has been really reassuring is that, I mean, you review the lab results very quickly and adjust the medication doses promptly whenever it's needed. So you also explained the trends and reassures me that the new dose should keep the levels in the appropriate range until the next lab results.
So I think this
Yeah.
is important because you are a unique person where you had the experience of your first pregnancy without hypothyroidism. And so I want
Right.
maybe our listeners to hear a little bit about your experience with that pregnancy. How was sort of care different then compared to the most recent pregnancy where you already had hypothyroidism and were reliant on levothyroxine care? Was there differences in the frequency of follow-up and frequency of blood testing? What was that experience like, but also to you in terms of perhaps anxiety that you might have felt?
So totally, there has been, definitely differences compared to my first pregnancy when I didn't have hypothyroidism. So back then, my care was very straightforward. I just followed the standard prenatal schedule routine, and just, the OB visits and regular blood tests, and I didn't need any additional monitoring beyond that. In this pregnancy, things are more closely managed because my thyroid hormone levels depend entirely on levothyroxine. Instead of just the routine prenatal labs, I now have thyroid blood tests about once a month, as I mentioned, to make sure the hormone levels stay in the right range throughout the pregnancy. And as I mentioned, it's not just monitoring. The hormone levels can shift fairly quickly during pregnancy, and as I mentioned, it makes me anxious. But it with a good close monitoring and having being in a good care, I get the dose get adjusted properly, and it makes it quite manageable.
And
Um,
I don't think I had known you during your first pregnancy yet, since you didn't have a thyroid disorder that we were aware of. But do you recall if you had thyroid blood testing in preparation for that first pregnancy, and what might have prompted the clinician at that time? Was there family history, or any sort of specific reason why they would have or would not have tested? Do you recall?
During my first pregnancy,
Yes.
actually, all the lab tests were very normal, and there wasn't any signs of hypothyroidism. So even before the pregnancy and during the pregnancy, all the blood tests were pretty normal. So
It's just that not all women in pregnancy get a thyroid blood test, but it sounds like the previous person who was perhaps the obstetrician who was taking care of you did, just to make
yes.
sure that all was well. So wonderful. And then finally, our last question is, how has your perhaps this experience around this condition, the hypothyroidism, and now that you've had two pregnancies, how has this experience impacted your thoughts about family planning in the future, and what would be your advice for maybe other women who are in your situation?
Sure. So, this experience has really shown me that pregnancy with hypothyroidism requires much closer monitoring, but it is definitely manageable with the right care. So, before going through this, I didn't fully realize how much thyroid hormone needs can change during pregnancy and how closely the levels need to be followed. So at times it can feel a little stressful, especially when I see fluctuations in the lab results and start worrying about whether everything is still in the right range for the baby. But having the doctor closely monitoring the labs and adjusting the levothyroxine dose properly whenever needed, so it makes a huge difference. So overall, this experience has made me much more aware of how important good medical support is in in these situations. At the same time, now that I've gone through this once and understand how the monitoring and those adjustments work, I feel like I would be much more comfortable handling future pregnancies from the thyroid management perspective. So I think it's pretty manageable once hypothyroidism women are aware of the process early on, and they expect the doctors set the stage for them early on, and they know what to expect during their pregnancy.
So much for sharing your experience, Masa. I think this has been invaluable. And for the listeners who are in a similar situation thinking about pregnancy, whether or not they know they have hypothyroidism, these are important things to consider. So thank you so much for your time.